Now, Israeli medical professionals have been working nonstop amidst the ongoing pandemic, and to honor them, the Israeli Air Force has even conducted congratulatory flyovers for Independence Day. But what is it actually like to be a nurse on the ground of this crisis? Well, joining us now to find out is head nurse of the ER at the Sheba Medical Center, Hindy Englard. So, how has your job changed in the last few months? I can't even imagine.
Well, of course, it changed dramatically. The Sheba Medical Center was the first to face COVID-19 suspected individuals in Israel. We spent a while preparing for the big surge of patients who are now eventually arriving in large numbers.
Mm-hmm. Well, I can imagine that there's been, just kind of a massive panic, especially in the beginning of dealing with these COVID patients. But how have you been able to separate actual COVID patients from those with corona-like symptoms, people who think that they might be sick but aren't necessarily?
Well, the ER, where we work, is the main port of entry to the hospital. And we played an important role as the main gatekeepers. We divided our ER into two main sections, our regular everyday ER with non-corona patients, and an advanced biological ER, which is also separated to three different sections for the different patients with different symptoms.
How is working in this environment, in the the Israeli health system, dealing with a crisis like this, made you feel about the health situation as a whole in the state of Israel? Do you feel that Israel has dealt with this properly, especially in your experience dealing with patients?
Yes, I do. We had very complicated challenges. We called for a new, innovative thinking, and they did very well. We are managing to protect our patients, and not less important, to protect our staff.
Right. I mean, have you been scared? I can only imagine what it's like to go in every day knowing that you're exposing yourself.
We're scared. We worked very hard on our ability to suppress our those kind of feelings. We have very dedicated teams, and also on our everyday job, when you see a patient who needs your help, you just go in and you do it.
You got to do what you got to do. Well, kol hakavod, all of the respect to you and the team that you're working with. You guys have been doing an unbelievable job. And again, thank you so much for joining us and giving us a sense of what it's like for you on the ground.
Thank you. Let's hope for better days.